Hello, everyone, and welcome back to the Down Syndrome Center podcast. As always, I'm your host, Dr. Kishore Volodi, and today we are going to bring to you the second of two parts of the Hearing Issues in Down Syndrome podcast series that we were doing with Dr. Heather Porter. So here we go. The other thing we get from families is that we'll hear from them, well, I can tell that they're hearing just fine, so we don't really need to do these hearing screenings annually, like we were saying, for their life. I might get like a 10-year-old and they'll say, well, they don't listen because they don't want to listen to us, but they seem to hear just fine. And so how would you respond to that in terms of, do those people also need to be getting hearing screenings, even if it seems that they're not complaining of hearing loss?
Yes, I absolutely. Just given the high prevalence of hearing loss, yes, 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 and yes again.
Yeah.
Because one thing that happens, and I mean, some of us might experience this with aging, is you have a gradual decline in your hearing. And so you might not be hearing as clearly as you once were, pardon me. Um, Even though you're not hearing as clearly, you're still not hearing 100% of what you need to. And especially for children who are still learning the language, their brains are not filling in um, what their ear is missing.
Yeah.
So yeah,
Yeah.
100%. It
I
needs to happen. And the other thing that I think also needs to happen that I want to encourage families on, I think it for many years and for good reason, you've probably families have been concerned. I there are a lot of serious health issues that can happen for infants when they're first born, for infants with Down syndrome when they're first born. If you're worried about a congenital heart defect in the life of your baby, I understand that hearing is not the first thing there. My sister was born with Goldenhar syndrome, not Down syndrome, but it's a syndrome that I remember we weren't really sure if she was going to live, and she clearly had hearing loss because she was born with one ear. And it turns out she did have hearing loss in her other ear, but the hearing was the last thing on my parents' mind, and you have to take everything one step at a time. But after things are stabilized, it's important to think, what will give my child, because everybody wants the best for their child, the best chances for success. And hearing everything that's around them is going to give them the best chance. We have a lot of times people will say, like, well, will I do okay without hearing aids? Will I do okay with just one hearing aid? And I don't find that anybody has a goal for their kid to just do okay. Everybody wants their kid to do the best that they can,
Right.
and getting their hearing tested and getting hearing aids on them if they need them is is kind of a no-brainer
Yeah.
coming from someone who's embedded in the world of audiology. One thing that I've found surprising, a lot of the families that we've met have maybe gotten kind of a different perspective from their primary care providers. And I can understand that. Primary care providers may have also been with these children ever since they were young, and they're happy to see them be so successful. And they might kind of downplay the extent of the hearing loss or the impact that hearing loss might have. But we've seen young school age children come in who have hearing loss that we would never accept to not be amplified if a child was neurotypical. And
Mhm.
I don't accept that for a child with Down syndrome. I have just as much expectations for the way that we're going to provide intervention to children and adults with Down syndrome as I do for anybody that walks in the door.
Yeah.
Um, one of, yeah, I mean, we had in our first round of early studies that we did in 2019, we had, let me think about this exact number. I a high percentage, I'm not going to make
Okay.
this up right now,
Yeah. Yeah.
a high percentage of participants that we saw would have qualified for hearing aids based on, the criteria that as audiologists we use. And only two people had them. And that was striking to me
Yeah.
because I, yeah, so we talked to families about, we did a more in-depth look into that and talked to them about what are some barriers that they are facing with hearing and hearing healthcare. And in some cases, families said that they were actively discouraged by primary care providers, like, oh, they're doing just fine, they're doing the best they can. And I think it's important to know what the guidelines are.
Yeah.
And I'm sure the families listening to this podcast are already well aware of the importance of advocating for their family members, and for the self advocates listening, how important it is for you to advocate for yourself. And hearing healthcare is no different. There are things that we can do for you, and it's your right to hear
Yeah.
well.
That's great. Yeah. So I definitely want to let our listeners know you're hearing it here very clearly that the hearing guidelines, the hearing assessment guidelines that are in the healthcare guidelines definitely are important to do. And so just to reiterate, at birth, there should be a hearing screen done at the place of birth, and then if that is passed, every 6 months until the children are able to give ear-specific hearing information, which for our patients is usually closer to 3 or 4. And then it's annual screenings from there on out. And as Dr. Porter was just discussing, there are interventions that can be done. Sometimes there's a little bit of fluid in the ear, and it's persisting. And so the ENT doctors might get involved and do things like ear tubes and otherwise. But other times there may be something more long-standing, and that can also be intervened upon. And now you've mentioned, Dr. Porter, a couple of times here about hearing aids. And I have heard, unfortunately, from some families that they have been told that because their child has Down syndrome, they either A, wouldn't tolerate a hearing aid or wouldn't be a candidate for a hearing aid. And I wanted to get your ideas on hearing aids and other hearing potential devices that may be helpful. What are your thoughts on that when it comes to this population?
Um, I don't think that anybody should be denied amplification because of the status of having, you know, any status
Yeah,
other
sure.
than, neurotypical. You shouldn't be denied, especially not individuals with Down syndrome who have such a high prevalence of hearing loss.
Hmm.
Um, I I think that if your provider is not taking your concerns seriously, it may be time for you to seek out a second opinion, either from a similar provider or go to an audiologist that specializes in working if you have a child. Some people, working with children who have hearing loss is very different than working with adults who have hearing loss. And so if you have a child, I would recommend going to a pediatric audiologist because they're going to be plugged into all of the techniques that are going to work to make that visit as positive an experience as it can be for you and your family, and for your child. And for adults, it's not that it's less important, but it's a little bit, the techniques are a little more common. So we just want to make sure that you get in to see a specialist who works with um, adults or children if you're looking at a child. And if you can find a center that works specifically with people with developmental differences or specifically Down syndrome, even better.
Yeah.
And I, for cochlear implantation, that's kind of a different story. I mean, that's a totally different type of, so a hearing aid, is an amplifier. You have hearing loss to a certain degree, to mild degree, to a severe degree. You're able to turn up sound so it's loud enough so it can be understood by the person with hearing loss. But sometimes hearing loss is so profound that there's no amount of volume that you can give the ear for it to work. And so a cochlear implant um, is a device that kind of replaces that hearing nerve. There's a much more extensive kind of candidacy evaluation that goes along with that. As an audiologist, I don't work with cochlear implants here at Boys Town, but our center, that it's a multidisciplinary team that gives an evaluation for a person and then determines whether or not they're a candidate for a cochlear implant. The reason that candidacy for a cochlear implant is so different is that there's such an intense period of therapy that's required and the family buy-in that's required. So having Down syndrome itself would not make you not a candidate for a cochlear implant, but just so listeners know, there's a way more in-depth process that you go through to get something like a cochlear implant. But for a hearing aid, or even a traditional hearing aid that sits behind your ear, or a bone anchored hearing device, something that you either wear on a soft band or that is held in place with a magnet or an abutment onto your skull, those are pretty straightforward evaluations that you would undergo.
That's great. Yeah. So I definitely, from what I'm hearing from you, if the child is qualifies for a hearing aid or any other type of hearing aid type device, they should not be automatically not considered because they have Down syndrome. In fact, they should be considered just the same as everybody else.
Absolutely.
Wonderful, wonderful. Love to
And
hear that.
monitored even more closely
Yeah.
because the likelihood of hearing loss is greater.
Yes. Right.
Yeah.
So
One thing,
please, yeah. No,
before
please do.
I
Yeah.
want to talk about a little bit more about the hearing loss that we're noticing, because I mentioned a little bit ago about how um, as we all get older, we might kind of expect that our hearing sensitivity might begin to kind of get a little bit poorer. For the general population, we kind of expect to see that around the age of 60 or 65. But the historic research that's been done and some of our research currently is showing that that high frequency hearing loss that we typically associate with aging is occurring at much earlier ages for individuals with Down syndrome. And when I say much earlier, um, by 20 years of age. So that's very, very young to start seeing high frequency hearing loss, you know, creeping in
Mm,
to an individual's life, but it is occurring. And I just want your listeners to be aware of that. Um, because even if your child's hearing was normal at 5, at 10, at 12, the likelihood that they're going to have some high frequency hearing loss starting, when they get to be about the age of 20 or even before is, it's the chances are it's more likely for them than it is for you.
wow, that's really amazing, and I think it highlights so much the need to continue those hearing screens even into adulthood. So I appreciate you sharing that with us. What are some of the studies that you all are doing at the Boys Town at this time, and would this be studies or things that you're recruiting for that you would want people from around the area or beyond to come and get involved in?
Yeah. So arms our studies right now are mostly focused on hearing, not a surprise.
Yeah.
So we're very interested in characterizing hearing across the lifespan. So that allows us to talk about things like the prevalence of high frequency hearing loss and when we can expect it to start, like I just explained.
Hmm.
But we're also looking at improving the clinical tests that we do. So without getting too deep into the details of what being an audiologist entails, we do know that all of our equipment, when we do a hearing test, is calibrated, and it's calibrated considering the size of a typical adult ear.
Hmm.
Um, Individuals with Down syndrome have often smaller ear canals, which impacts the level of sound that we're measuring in there.
Hmm.
This is something we think about all the time when we fit hearing aids on babies, because if you have a smaller ear canal, the sound is much, much louder than if you have a large ear canal. And so we monitor those levels closely when we fit a hearing aid on a baby, for example. And even when we provide hearing aids to children, we still think about that, like the impact of individual ear canal acoustics. This is not something we're considering when we're providing hearing tests currently. And our thought is that we could really be underestimating the levels of hearing loss that individuals with Down syndrome are experiencing. So to put it another way, we know that if you have a small ear canal, the sound is louder. So
Hmm.
if I play a sound into a small ear canal, and I think that it's at a soft sound, but it's actually louder, and you're responding as if you hear it, then I might kind of think in error, hey, you have normal hearing. This is
Oh,
great.
interesting.
But
Uh-huh.
really, the volume is louder for you than I'm intending. So, one of our big focuses, one of the things that we're doing is characterizing the way that sound is going into ears. So, in case we need to think about different calibrations that are required, or maybe even calibrating in real time as we do these hearing tests for individuals with Down syndrome, especially, so we can be more accurate about the hearing test that we're doing. Um, we're doing this for regular hearing tests, so the kind of hearing tests where you hear a beep and press a button. And we're also doing it for those early hearing tests that we do for babies when they're first born. We've talked a bit about newborn hearing screening, and how we're doing that is we're actually monitoring the response of the brain to sound. So it's really cool. And there's a body of literature, a body of research out there that says that these auditory brainstem responses for individuals with Down syndrome are different than they are for neurotypical individuals, which has been something that's perplexed me since I was in graduate school, because the differences are that the responses of individuals with Down syndrome seem to occur more quickly than they do
Huh.
for individuals who are neurotypical. Um, But now here's the interesting part. If you play a sound that's louder to an ear, you'll see quicker responses on that brainstem. So one of the hypotheses that we're following up on is that it's not that there are differences in the brain structure of individuals with Down syndrome, but maybe just that we're playing sounds louder than we think. And
Interesting.
that's what's causing those faster responses. Um, we're very interested. Another arm of the study is looking at speech perception and background noise. As I talked about at the very beginning, it takes a lot of auditory experience, good auditory experience, for your brain to learn how to kind of turn down that the background noise and listen to the auditory signal that is providing you with information. Um, because of the high prevalence of hearing loss in individuals with Down syndrome, especially the kinds of hearing loss that occur uh, that seems to come and go with frequent ear infections coming and going,
Hmm.
that process is disrupted. And so looking at the impact, or looking at the ability of children and adults with Down syndrome to hear speech and background noise and characterize what are some of the things that we know make somebody a candidate for doing better than another person, so we can start to identify maybe some therapies that can help. um, those are a couple of our ongoing studies right now. So we are actively recruiting. Of course, if you're here in Omaha, Nebraska or thereabouts, it makes it a little bit easier. You can
Sure.
just um, reach out. You probably already know about the study. And thank you for participating if you already have. If you haven't, consider coming over. But we also have a mobile research vehicle. It's basically it's a big RV. And we are um, we have community partners that we go and we park the RV at for 3 or 4 days at a time, and participants can come and be seen in our mobile unit. We have plans to be in Denver in April. Excuse me. We have plans to be in Denver in April, um, Kansas City in December, plans for Florida and Louisiana in the works. If you are in a center, or maybe you're not even in a center, you're just a family and you think, hey, I'd be interested in participating, but I can't come over, but I have some friends, or if you're interested in participating as part of the mobile unit, you can reach out also.
Oh,
Um,
that's great.
the easiest way to reach us is probably by visiting our website, and then there's a contact us button.
Hmm.
Um, and our website is www.boystownhospital.org. So all one word, /project include, and
That's
that'll
great.
get you there.
That's fantastic. I love that. I love the mobile option as well. Maybe that mobile option will come through Pittsburgh. We'll gladly find some families that would be interested in being a
Oh, we
part of
should
this.
talk. I would love to come back to Pittsburgh. I think I told you
Definitely.
that I grew up there.
Yes, yes, that's great. That's great. Well, thank you so much for joining me on this podcast today. So much great information. Is there anything that you wanted to make sure you leave with our listeners before we end the podcast today?
Thank you so much for
Yeah,
inviting me and giving me the opportunity. I think that good hearing is imperative. It's
yeah.
possible. And I think that hopefully we are doing our job and empowering people to be good advocates for themselves and their family members.
I love that. Yeah, definitely. And I love the work that you all are doing. It's actually within the field for folks who are listening to the podcast, within the field of audiology. It's quite well known what the work that's being done at Boys Town. In fact, so much so that my wife, who is an audiologist, when I said I'm going to do an audiology podcast, she said, "Oh, it must be with somebody from Boys Town." So people really do know about the work you all are doing there, and I appreciate you coming and sharing on the podcast today. So thanks again.
Thank you so much for having me.
And to our listeners, thank you so much for listening as you have done for so many years now. If you have any podcast questions that you would like us to address, please do reach out to us at Down Syndrome Center at chp.edu. We do read each and every one of those emails, so please do reach out. And I'd be happy to find speakers to join me to talk about the topics that you suggest. And if you would like to join us in the work that we do here at the center, including this podcast, please go to givetochildrens.org/Down Syndrome Center. But until next time, bye bye.